Have you ever had a tooth infection that spread to your lymph nodes? If so, you know how painful and uncomfortable it can be. But did you know that there are ways to prevent this from happening? In today's video, we will discuss how a tooth infection affects the lymph nodes and what you can do to protect yourself. Stay tuned. What is a tooth infection? A tooth infection, often referred to as a dental abscess, occurs when bacteria penetrate the protective layers of a tooth, causing an inflammatory response and the formation of pus. This typically happens when bacteria reach the inner part of the tooth, which houses the nerves and blood vessels, or when bacteria invade the gums or bones supporting the teeth. How does a tooth infection affect the lymph nodes? When a tooth becomes infected, the bacteria can spread to the nearby lymph nodes through to roots. The first is through direct spread, where the bacteria from the abscess travels through the soft tissues of the mouth to the lymph nodes. The second route is through the lymphatic system, where the bacteria is transported via the lymphatic vessels to the lymph nodes. Once in the lymph nodes, the immune system attempts to eliminate the bacteria, leading to inflammation and swelling of the nodes. This process is a normal immune response and serves to contain the infection and prevent its spread. However, it can cause discomfort and pain until the infection is resolved. Causes of swollen lymph nodes after a tooth infection. Several factors can contribute to swollen lymph nodes after a tooth infection. The most common cause is the spread of bacteria from the site of infection to the lymph nodes. Another cause is the body's immune response to the infection, which causes the lymph nodes to enlarge as they produce more white blood cells to fight the infection. Additionally, if the lymph nodes become blocked by swollen tissues or abscesses, it can also lead to the accumulation of fluid and cause swelling. Symptoms of tooth infection with swollen lymph nodes. A tooth infection with swollen lymph nodes can cause a variety of symptoms, including a bad taste in the mouth, difficulty chewing, swelling in the cheek or gums, fever, and pus around the tooth. The lymph nodes may be swollen and tender to the touch, and you may experience general discomfort and fatigue. How to manage a tooth infection and swollen lymph nodes. If you suspect you have a tooth infection with swollen lymph nodes, it is important to seek treatment promptly. A dentist or healthcare provider can diagnose the underlying cause and recommend appropriate treatment options. Treatment for a tooth infection may include a root canal to clean and disinfect the affected tooth or antibiotics to kill the bacteria causing the infection. In some cases, a tooth extraction may be necessary if the tooth is severely damaged or cannot be saved. In conclusion, a tooth infection can spread to the lymph nodes, causing discomfort and pain. While the immune system works to fight the infection, you may experience symptoms such as swollen lymph nodes, fever, and difficulty eating. To manage these symptoms, it's important to seek treatment from a healthcare professional who can determine the best course of action. With proper treatment, you can alleviate your symptoms and prevent the infection from spreading further. Thank you for watching today's video. If you found it helpful, please don't forget to like and subscribe for more informative content like this. Stay healthy and take care.